Hello, and welcome to today's masterclass, Dr. Wild's No BS IBS solution, the no-nonsense proven process to transform debilitating digestive distress into lasting digestive relief without taking medication. Now, before we start, there are a couple of things that will help you get the most out of our time together. Number one, make sure your sound is turned all the way up. And number two, have a piece of paper and a pen handy, because what I'm about to share with you will change the way you think about your IBS forever. Have you ever noticed there are some people who can actually eat out whenever they want and never have to worry if a bathroom is nearby? Or they can seemingly eat whatever they want and never have digestive distress. And they're able to have normal bowel movements and even go once or twice a day, every single day. Was there a time when you could have normal, well-formed daily bowel movements? Can you remember that far back? Was there a time you didn't have cramping constipation or explosive diarrhea, or worse, back and forth between both? Was there a time where you weren't gripped by the fear of desperately needing a bathroom right this second, and then terrified to realize there wasn't one anywhere in sight? Well, if this is you, don't panic, because I'm about to throw you a rescue roll. This is for you if you're tired of missing out on delicious meals with friends and family and desperately want to take part in their celebrations again. This is for you if you're truly sick of feeling sick, stuck on the toilet and in distress, while everyone else is out enjoying life. This is for you if you think you've tried everything, but nothing works. This is for you if you're finally ready to really fix it and just feel normal again. And no, it won't take an act of God. My promise to you is that in this 45-minute masterclass, I'm going to share with you my exact 4-step, cutting-edge functional medicine process that can transform your lifetime of digestive distress into lifelong digestive relief. And get this, in just 3 short months. And no, I'm not kidding. You're going to discover why past methods to help you have failed to actually correct your problem, and, more importantly, what you must do differently. You're going to discover what you need to do to feel normal again, free to enjoy your life, having dinners with family, out with friends, or spending time with that special someone. I'm going to teach you the exact steps necessary to not only feel better fast, but to finally fix it for good. And I'm going to ask you to finish what you start. Sit down and buckle up, because I'm going to share with you information that literally can be life-changing, and I really would like you to focus and pay attention. And if you do, I'm going to share with you a very special gift at the end of our presentation. Let's get started. Which of you remember this commercial? It looks funny now, but for those of us who suffer from IBS, especially the kind of diarrhea, we know this is no laughing matter. Are there days you just can't get anything done because you simply can't stop running to the bathroom, or you just can't seem to go at all, and you waste precious hours of your life just sitting there on the toilet? Does it ever seem like you'll just never be normal in the bathroom again? You know, out in just 5 minutes, 1 or 2 times a day. Have there been times you literally just sat and cried out of IBS frustration? Well, if this is you, you're not alone. You see, 20% of the world has IBS. Painful gas, frequent bloating, altered bowel function, with dreaded and distressful toilet time. If you just can't seem to really get better, it's not your fault. You see, the real problem is the usual medical approach to treating IBS is simply just managing the symptoms, never actually detecting and correcting your personal, specific, underlying causes. The typical drugs used to manage IBS are mostly useless, mildly helpful at best, and at worst, can even damage you further, leading to a lifetime of continued digestive dysfunction and despair. Here's why I say that. If we look online at PubMed, the published medical congressional repository for all published medical literature, we see study after study regarding the use of drugs for the treatment of IBS. What we don't see in these studies is that they are truly effective. Take a look at this. One study shows us that bulking agents are not more effective than placebo at improving irritable bowel syndrome, and antispasmodic agents available in the United States are no more effective than placebo for treating IBS, and there are no randomized controlled trials examining the efficacy of laxatives for managing your IBS. But I have good news. I've figured out a unique and effective way to solve this problem, and I'm going to walk you through it today, right here in this webinar. You see, the key to your success doesn't lie in yet another pill or magic potion. The key to your success lies in a process, a 4-step process to be exact. With this process, you'll wake up each morning feeling excited and freely able to say yes to enjoying a night out with your friends and family. You won't have to experience the utter humiliation of being a potty prisoner ever again. And the best part is, even if you've tried all the diets, you know what I'm talking about, low FODMAPs, gluten-free, elimination diets, the low-fat diet, the high-fat diet, the eat more fruits and veggies fiber diet, the eat less fruits and veggies fiber diet. Seriously? Even if you've been told it's in your genes, so you're just stuck with it, that's not necessarily true. Even if your doctor said there's nothing that can be done to fix it, what they really should have said is there's nothing they could have done to fix it. Even if you think it'll be too complicated, or take too long, or be too expensive to fix, I'm here to tell you none of that's true. If you think it's all due to stress and, well, you simply can't change that, I'm here to teach you something else. And if you think since you've had so long it must be too late to fix, I've learned it's never too late. And if you don't want another generic one-size-fits-all, promising pie-in-the-sky results, then you're in the right place. You see, the only reason I could share this program with you, with the confidence I have, is because I've been through this, the good, the bad, and let's face it, the ugly. Hi, I'm Dr. Michael Wild. I'm best known for helping apparently helpless cases. You know, those people who are written off as incurable, regain their lost health, and finally just feel normal again. I'm the author of the Holistic Handbook, a 219-page self-help guide. I'm also the founder of a unique healing center in Richmond, Virginia, called Dr. Wild's Advanced Health Restoration Solutions. So, who am I really, and why should you trust me? Well, I've had 30 years' experience as a holistic doctor. I began my career graduating the top of my class from Boston College with a degree in psychophysiology, which is a deeper understanding of the brain-body connection. I then went on to become a chiropractic physician, studying methods of functional neurologic integrity to learn how to get that brain and body to communicate even better. I then went on to learn about functional medicine and became a certified cellular healing specialist, which means I correct hidden inflammation and hidden toxicity as a common cause of disease. And in this webinar today, I'm going to teach you how that relates to your IBS. I'm also an avid biohacker, using scientific shortcuts for the fastest results possible, which I include in all of my programs. And I'm a fellow IBS sufferer, or at least I used to be. You see, even though I'm now a sought-after expert in this area, I want you to know that things certainly weren't always this way. Let me show you what I mean. My IBS journey started way back in high school, where I suffered from IBS-M, or the mixed kind. That's the kind that alternates between constipation and diarrhea on different days, and sometimes even the same day. And that continued all the way throughout my college career and even throughout graduate school. Let's face it, I was absolutely no fun on dates or at gatherings with friends and family. They were always asking, where'd he go now? The worst memory I have that sticks out is I had a massive diarrhea attack just moments before sitting for my national board exams. Now you have to understand, these are the exams that determine whether or not I get my degree and if I'm able to actually practice the chiropractic sciences that I've been studying for years. And just minutes before they're going to lock that door to the exam, I felt a grumbling in my bowels. You know what I'm talking about. I ran in a panic to the bathroom, knocked the door open, sat as fast as I could, just in time, and had massive diarrhea with cramping. I was pale, I was clammy, I was sweating. I was freaked out. If I didn't get through this quickly, I wasn't going to be able to sit for my exam. Once that door locked, I was not getting in. I would have to wait a full year before trying to take this exam again. And then it dawned on me. This exam was for 8 hours each day for 3 days in a row. Thank God I was able to pucker up and get through my exam. But I didn't stop there. I experienced continued constant diarrhea and constipation for 20 years after that. I resigned myself to a life of stress, frustration, and worry. And let's face it, that's a really crappy way to live. Finally, I had simply had it. I said enough of this crap already. I was done with feeling helpless and being told there was no solution. I just had to live with it. I woke up one day about 10 years ago, resigned to finding a better way, a different way, a personal way to finally fix it for good. That's the moment when I realized that my unique background, my education, my skills, and my perspective would allow me to craft my own personal perfect solution to this unbearable problem. That's the moment I started to create my NO BS IBS solution. What I discovered way back then that made all the difference was that all current medical treatments for IBS did absolutely nothing to find the unique underlying causes or even attempt to correct them. And most importantly, I found out those causes were different for different people. You see, I found out there was no magic one-size-fits-all solution, but I did discover that there was an almost miraculous process. Once I determined and performed the correct advanced tests to discover my individual unique underlying cause and the triggers of that cause, the power was mine again. All I had to do next was lay out a specific, personal, step-by-step plan of action. And most importantly, I needed to take that action. Now, I have no reservations or fear in saying yes. I can gladly eat lunch with you and even hang out a while. I can happily go to dinner and stick around for the movie. I can confidently go hiking in the woods all day, the way I love to, even with no bathroom in sight. And I can take that road trip for hours without frequent, frantic stops. And most importantly, I could finally feel good about myself again. I could hold you close. I could spend the night, cook you breakfast, and even serve it to you in bed, all without having to excuse myself for repeated, embarrassing bathroom breaks. And come on, if you have IBS with diarrhea, you know exactly what I'm talking about. And I'm about to get personal for a second. I can distinctly remember one date I was on where, just when things were getting good, I had to run out to the bathroom. And I was in there for about 20 minutes. Every time I tried to get off the bowl, here it came again. Wave 2, wave 3, wave 4. My date was knocking on the door, asking if everything was okay. By the time I finally got out, I swore I could still smell it. Not just in the bathroom, but I thought it was even on my body. Yet I knew I cleaned myself fully. I think it was actually stuck up my nose. A horrible feeling. I actually had to excuse myself and just leave for the evening. You see, you and I are similar. Listen, I'm no superhero, just a regular person who went through hell and back. So if I can do this, you can too. Imagine how good it will feel when your IBS issues are a thing of the past and you've gotten your life back. I've said it before and I'll say it again. The old ways of treating IBS simply don't work. In fact, most are total BS. You're an individual with individual issues that need to be corrected for complete healing and correction of your IBS. Now, I've discovered 3 simple ways to do this. There are 3 key discoveries to solving your IBS, and I'm going to share them with you right now, so please pay attention. Discovery number 1. The drugs you're taking for your IBS could actually be making you sicker instead of better. You see, drugs provide only temporary relief at best and can lead to long-term intestinal and whole health damage at worst, without ever actually stopping the underlying cause of your IBS or healing your hidden intestinal damage. Let me explain to you why I say that. If we go back to some of those studies I shared with you earlier, and we break it down, let's take a look at some of the more common drugs that are prescribed to treat IBS. First, let's look at tricyclic antidepressants, which are most likely prescribed for IBS-M, the mixed kind of IBS that alternates between constipation and diarrhea. The way these drugs work is they help keep more serotonin, your happy hormone, and norepinephrine, another neurotransmitter in your brain, available to your brain. And what these do is these are the hormones your body uses to help you handle your stress reactions. So the doctors figure if they put you on an antidepressant, maybe you won't be so stressed, and just maybe that won't trigger an IBS episode. Sounds like a good idea, right? Until we look at the side effects. And by the way, folks, think about this. Side effects are not really side effects. They're all direct effects. Every effect of the drug is a direct effect of the drug. The side effects are simply ones they don't want you to think about. Well, look at this laundry list. And on this list, these tricyclic antidepressants can even cause constipation and diarrhea, as well as nausea, some of the things you were trying to avoid. Now, let's look at Imodium. Imodium was usually prescribed for IBS-D or diarrhea, and we've all seen the commercials, including that initial advertisement I showed you in our presentation. Well, Imodium works by making the muscles in your intestines contract more slowly, so your stool comes out more well-formed. Well, that sounds like a good idea, doesn't it? Again, until we look at the package label. You see, Imodium can actually lead to the opposite problem, more constipation, nausea, and this time, even swelling of the abdomen and pain in the abdomen. Two things I'm trying to get away from. All right, let's look at the next drug, Tegaserod. This was prescribed for IBS-C or constipation. Again, it's acting on those serotonin receptors, but this time not in the brain, but in the intestines themselves, to promote intestinal peristalsis, which is the action your body uses to push stool along and get it out into the toilet. This would increase your gastric emptying and also decrease esophageal reflux, or indigestion and heartburn. Again, that sounds kind of like a good thing, doesn't it? Until we look at the side effects of that drug. You could get diarrhea, stomach pain, and this time even bleeding from your rectum and bloody stools, but it doesn't stop there. You can get more nausea, and get this drug can even lead you to thoughts or attempts at killing yourself. Thankfully, this drug was recalled due to creating cardiac events and breast cancer. Let's look at the last drug, Elocitron. And this one's prescribed for IBS-D, for diarrhea. And this time, it blocks the action of serotonin in your intestines. This would slow the movement of stools or bowel movements through your intestines, therefore slowing down your diarrhea. But again, you guessed it, side effects. Elocitron causes constipation, bloody diarrhea again, new or worsening stomach pain and discomfort. There's that rectal bleeding again, and right on the label, it actually says, this is not a cure. And after you stop taking it, your symptoms could return even within just 1 week, and it's not been shown to be effective in men. This drug can also lead to serious gastrointestinal adverse reactions, including ischemic colitis, meaning it's cutting off the blood flow to your bowels, and serious complications or constipation that results in hospitalization and even death. Let's move on to discovery number 2. If you've been told it's in your DNA, I'm here to teach you that your DNA is not your destiny. And in fact, science has shown that only 3% of all disease is actually genetic. Well, that means that 97% is lifestyle-induced, which triggers your genes to behave badly. You see, there's a concept known as epigenetics. Epi means above or beyond. So what we're talking about here is what is above or beyond your genetics in controlling how your body works. So we have learned through the Human Genome Project that the human body has over 20,000 different genes, and each of these genes has a different function. However, each gene truly has multiple functions, and your lifestyle or the stresses of your environment actually determine which of those functions get expressed or turned on and turned off. You see, epigenetics is the study of how your behaviors and environment can cause changes that affect the way your genes work. But unlike genetic changes themselves, epigenetics do not change your DNA sequence. They only change how your body reads your DNA sequence. And because of that, epigenetic changes are reversible. Now, I know this chart may look a little scary or intimidating, but let's walk through it for a second. This chart talks about your reaction to environmental factors like tissue stresses, like inflammation to your intestines, or injury, or pathogens like bacteria or viruses affecting your body. Well, when all these things happen to your cells, our cells have to react. And that reaction is determined by your genetic code you're born with, as well as by those epigenetic factors of your lifestyle. You see, there's a saying within genetics that says, while your genes load the gun, it's your environment that pulls the trigger. And when that trigger gets pulled, how are you going to react to those environmental stressors? Well, you're going to have some type of physiological inflammation. And inflammation is actually important. It activates your immune system. Without inflammation, you can never heal a cut or fight off a foreign invading organism. Without inflammation, you would simply die. But we want that cut to heal, and we want those bugs to be killed off and have everything go back to normal, which is called homeostasis, or return to normal balance. Epigenetic factors are influenced by different stresses of our lifestyle that can cause a failure of the inflammation to resolve, which leads to pathological inflammation, chronic inflammation, non-resolving tissue damage, which ultimately leads to disease. How does this happen? You see, chronic inflammation changes your body's biochemistry, and particularly it creates something called thromboxane A2. And thromboxane A2 creates things like irritable bowel syndrome. But notice that the arrow is a two-way street. The longer you have irritable bowel syndrome, the more you create more thromboxane A2. Well, what else can this cause? It can lead to a higher rate of infection. It can lead to autoimmune disorders and reduced immune function, such as what we see in AIDS. It can lead to erectile dysfunction, asthma, arthritis, fibromyalgia, Alzheimer's, cancer, autoimmune, chronic obstructive pulmonary diseases or breathing problems, type 2 diabetes, obesity or difficulty losing weight, atherosclerosis or hardening of your arteries, stroke and heart disease, and peripheral arterial disease. You see, irritable bowel syndrome can become much more. But epigenetics plays the largest role. Your epigenetics can be unleashed by consuming personally inflammatory foods and chemicals. You need to do the right tests to find out what they really are, and then learn how to specifically avoid them for a brief period of time to reset your immune system. Epigenetics is also triggered by pathogen and toxin exposure through your air, food, and water. You need to find out what these exposures are and how to safely remove them. Epigenetics is also triggered by your stress responses, even your thought triggers. You need to find out how to effectively handle your stress using modern technology as a biohack shortcut. You see, you can take back your power, just like I did. Discovery number 3. Anyone who tells you that this IBS is all in your head, they're the crazy one, not you. You see, my background in psychophysiology has taught me that emotions and stress absolutely do play a role. However, they can be effectively controlled using advanced technology and techniques that stop the negative effects of stress and anxiety on your intestinal function. You see, there's a physical cause of the connection between your stress and your bowel function. That physical connection is called the vagus nerve. It's the longest nerve in your body outside your spinal cord that goes from your brain directly down and connects to all of your major organs, including your intestines. And research has shown us that stimulating that vagus nerve effectively and appropriately can have a very positive effect on rebalancing your gut-brain connection. Using specific technology with just the right frequencies of electrical stimulation can actually activate your healing repair between your gut and your brain and literally stop the effect of stress on your intestines. You see, the key to your success is following a proprietary 4-step corrective care process that addresses all of these issues and is specifically designed to discover your unique underlying hidden cause for your IBS and to actually fix them, rather than just continue to temporarily treat your symptoms. This process is called Dr. Wild's No BS IBS solution. So let's break it down. The first T stands for test, and not any old test. You need to stop guessing what your problem is. Your doctor has to stop guessing what your causes of your problem are. You need to do the right, specific, advanced tests to determine exactly what your causes are in order to remove them. The second T stands for target. We need to choose amongst the problems that we find which ones are the priority. We need to target those, correct them first, and connect the dots, and redirect the body into a healing process. The next T stands for treat. We have to use just the right processes to treat the underlying causes of your IBS, to finally correct them and restore normal health forever. And finally, we need to repeat our initial test to confirm we've actually done what we set out to do. I mean, really, if you don't map out a very specific target to hit, how are you ever going to reach your goal? And if you don't monitor your progress along the way, how will you ever know if you're actually getting there? I do not base my care plans in my programs on just how you subjectively feel. Of course, it's important to me you feel better, but I really want to know, are you healing better? And that's done by testing, targeting, treating, and repeating. This is how we rebuild your health from the ground on up. Let's hear what some of my patients have to say. Leanna says, Dr. Wild is so knowledgeable and so comforting. I'm so incredibly happy to have found such an amazing doctor to start my journey to a new, healthier me. Tasha says, Dr. Wild provides an amazing program and coaching on how to reverse the damage we've accumulated and done to ourselves over our lives. I've learned so much about cellular health, where the fatigue, the joint and muscle pain, and the gastrointestinal upset were coming from. And now I'm healing after being told for a few years that I was perfectly healthy according to my lab numbers from my traditional doctors. Does that sound familiar? And Lisa says, after being in and out of doctor's offices and emergency rooms for 16 years, only to be diagnosed with diverticulitis and celiac disease, I finally joined Dr. Wild's program, and I realized that most of my issues can be resolved with a proper personalized diet and nutrition. I highly recommend making a difference in your health by seeking the guidance of Dr. Michael Wild. Let's talk about Lisa in a little more detail. You see, Lisa had lifelong digestive difficulties, mostly IBS-D, the constant diarrhea kind. She had repeated hospitalizations over and over for years. This, at one point, even led to emergency gallbladder removal while on vacation in a third world country. She had no choice but to go on a scary, bumpy ambulance ride over unpaved roads to a hospital that she was not really confident in. Her life and her health were in their hands. She was also diagnosed with diverticulosis and diverticulitis, which eventually evolved into ulcerative colitis and rectal bleeding. And while she mentioned that she was diagnosed with celiac disease, my advanced test determined that she did not actually have celiac disease. In her case, she really had celiac-like syndrome or severe gluten sensitivity. This led to hormone imbalances and even headaches. But thank God, we were finally able to help her get all fixed and functioning in just 3 months. You see, you're here because you're committed to doing what it takes to get your life back, right? Just like Liana, Tasha, and Lisa. And if you're anything like me, I bet you put a high value on your time. And you've probably already enjoyed success in other areas of your life by focusing just on the things that get you real results. You now know that typical traditional treatments for IBS simply don't fix you. At best, they're barely an effective Band-Aid, and at worst, they are complete and utter BS, which do absolutely nothing to help heal your damaged, dysfunctional digestion and can actually make you worse or even kill you. And I've shown you that I've created an exact 4-step, cutting-edge functional medicine process that can transform your lifetime of digestive distress into lifelong digestive relief. It's a no-nonsense, no BS, proven method to fix your IBS in just 3 short months. We've also seen that the old ways of doing things simply don't work. We've seen that the best way forward is by trying something new, something unlike anything you've tried before, and something based on correcting your unique, personal, underlying causes. Because it's proven to give people just like you the results they want. You can do this. We can do this together. Just imagine how great it will feel when you finally no longer have to struggle with embarrassing bouts of diarrhea or painful, prolonged constipation. Feel how good it feels when you can say, yes, I would love to go out to eat with you, and never have to worry if a bathroom is nearby, and please God, make it private. Or if you'll even be able to go once you get there. They'll no longer have to say, what's taking her or him so long? And if you'd like me to help you do this, well, honestly, I'd be delighted. Because there's one thing I know for sure. Doing this alone isn't easy. And here's why. You see, I have found that humans left to their own devices are master procrastinators. And you absolutely need accountability in order to succeed in fixing this. How will you know the new and different ways to actually fix your IBS if you keep on following the same old outdated advice? You need to learn something new. And I found that books, podcasts, and do-it-yourself courses are all great for gathering knowledge, but not for health transformation. Let's think for a second about what successful people do. You see, successful people figure out what they want and why they want it. Then they ask who, not how. Let me explain what I mean. If you had a leak in your roof, would you figure out how to fix it? Well, if you did, that would likely involve you going to Home Depot or Lowe's, buying some shingles, climbing up onto the roof of your house with little idea of what you're doing, and somehow fix your roof. I think no sane person would do that. Unless, of course, you love DIY work and you're super handy around the house. Well, I know I'm not. But this type of thinking really holds people back in life because they try to do it themselves, to do it their way, all just to save a few bucks. And although it may eventually happen, the road is filled with mistakes, lost time, tons of frustration, and eventually a lot of money down the drain. And I have found over my lifetime that money is cheap, but my time is expensive. You see, successful people who actually heal their IBS don't waste time trying to figure things out on their own. They look for their who, the expert who will lead them to the results they want. They ask, who can help me fix this problem? That's a much smarter question to ask, isn't it? And you're just a phone call away from the help you need. So here's exactly how I can help you. My team and I have set aside a few slots in my calendar to speak with you personally, absolutely free, about how you can apply my unique strategies right away and start getting results. On this free IBS correction call, we'll see if you fit the criteria to truly succeed with my proprietary program. And if so, we'll also put together a personal plan for your specific situation to help you finally beat your IBS for good. Just like Liana, Tasha, Lisa, and me. So, if you want to finally feel better and actually be better, if you want to be free to enjoy life again and to even lower your risk of developing those chronic diseases to help ensure a longer, healthier life, and if you want to do it all without ending up frustrated and disappointed just once again and without taking one more dangerous drug, then this phone call is for you. Here's exactly how we'll do this together. First, we'll uncover your personal blind spot. That's the all-important one thing that's been blocking your success in actually correcting your IBS. And it's the number one reason why you're stuck. And it's probably not what you think. We'll also customize a plan that will get you unstuck and that will give you the results you're looking for. And finally, we'll determine if it makes sense for us to work more closely together. So, why am I offering this free call when normally I charge $250 an hour for my time? Well, the reason I offer this free call is because I believe it's the only true way to start a relationship out on the right foot. And honestly, I think it's the only moral and ethical thing to do. After all, I figured out how to fix IBS. I did it for myself. I've done it for tons of other people, and I truly believe I can do it for you too. I can't keep that information to myself. The other reason I offer this call is because I know a good percentage of people I speak with will want to work with me so they can meet their goals in the fastest amount of time possible. And if you find the plan that I put together for you helpful, and you choose to want to work together thereafter, then I can tell you more about my No BS IBS solution program. And I'll tell you right now, it's not cheap, but it's also not overly expensive. And certainly a lot less than trying to do things on your own and continuing to struggle. And if we're not a good fit together, hey, there's no hard feelings, and we'll just part as friends. But before we go any further, you need to know that I know I can't help everyone. Based on the hundreds and thousands of people I've helped, I know there are certain types of people who will get results and those who won't. And the last thing I want to do is waste our time together if you're not the type of person who will see results with my program. You see, this is not for you if you're not ready to do what it takes. This is not for you if you're not willing to make changes. And this is not for you if you're not able to spend the time or money to finally really get well and finally feel normal again. But this is for you if you're truly sick and tired of being sick and tired, confused, frustrated, embarrassed, worried, and afraid. This is for you if you're ready to do what it takes to really get well. This is for you if you're willing to follow the exact corrective game plan I create for you and to be held accountable. This is for you if you're able to devote just 1 to 2 hours per week and invest a few well-spent dollars in finally fixing yourself. If you meet most of these criteria, then you have what it takes to get the results, just like Liana, Tasha, and Lisa did. So here's what to do next. Simply go to www.canihelpyouribs.com. And if you want to see what's been keeping you from finally actually correcting your IBS, if you want to get a customized, personal plan to truly heal better and not just feel better, and if you want to see if working together will get you even better results, then this is for you. Simply go to www.canihelpyouribs.com. You have to remember, time is of the essence. Since I only have so much time to do these calls each week, this is on a first-come, first-served opportunity. And once these spots fill up, well, I'm sorry, but they're gone. So if you're serious about truly healing your IBS and you meet my ideal client criteria, then again, go to www.canihelpyouribs and book your call right now while this is still top of mind. Without knowledge, action is useless, but knowledge without action is futile. So if you don't have new knowledge and keep taking the same action, let's face it, don't expect a different result. Because if you change nothing, nothing will change. Now you've watched this entire training. You want to not only feel better, but to also heal better and finally be better. And you know you're simply not getting the results you want on your own. So take advantage of this opportunity now. Schedule a call with me by simply clicking the link below or going to this URL. There, you'll be able to grab a time to chat in the next 48 hours. And once your time's been selected, you'll then see a form with a few questions I'd like you to answer so I have a better idea of where you're at and where you want to go. That way, our call together is as productive as possible. Are you ready, willing, and able? Let's find out, and let's do this together.